Welcome to Everything Medical, the lovers of everything medical. On today's video, we shall be appreciating the bony structure which is called the tibia. The tibia is the second longest bone in the human body. It is the main bone of the leg or the major bone of the leg. It can be called the shin bone, right? That is why footballers usually wear a guard called shin guard in order to protect the tibia from fracture. Either the fracture at the shaft, because that is where it commonly fracture. It mainly fractures at the shaft. So, footballers, they have to protect it because that is actually the major bone of the leg. If their tibia got fractured, that is the end of their career in football. Even if surgery is performed, it will not be giving them the weight bearing of the body as it was giving them when it has not been fractured, right? Now, if you are coming across to my channel at the first time, please subscribe, comment, share, and like, and also invite your friends to our channel where we teach with structures. We teach with physical structure so that you understand everything about the bony structure that you are studying on your closet. Now let's proceed. Here on my hand is a bone called tibia, which I had already introduced. So the tibia is the second longest bone in the body, while the femur is the first, right? So as you can see, this bone now is so strong. It plays a lot in aiding weight bearing of the body, right? So it is a long bone because it has two ends. It has two ends, the proximal end and the distal end, and also the central shaft, which spans from the distal end to the proximal end. So here is the central shaft or the central portion of it, which is called the shaft. So that is what that makes it to become a long bone, right? Now, let's quickly discuss the features of the proximal end or the upper end. So, this is how this bone is placed. This is the anterior aspect of this bone. Why this is the posterior? Have that in mind, right? So, this bone or on its proximal end has a profound feature in order to maintain the stability of the knee joint, right? The proximal end of this bone is widened. Is widened by its medial and lateral condyles. It is widened by its medial and lateral condyles, which aid in weight bearing of the body, right? It aids in weight bearing of the body. Now, this medial and lateral condyle bears a flat surface, which is called the tibia plateau surface. So here is the flat surface. This is the flat surface. This is the flat surface. It has already been marked because this is the place or the region whereby the femoral condyle of the femur articulates to form the knee joint, right? So the upper proximal part of this bone bears a condyle, a medial and lateral condyle, which contains or also bears a flat surface, which can be called the tibia plateau surface, which accommodates the femoral condyles on the distal aspect of the femur to form the knee joint. You can see that as this bone is going up, as it's going up on the proximal aspect, it becomes widened in order to form this medial and lateral condyle, because this is the medial condyle. Because if you want to identify the side termination of this bone, you have to check the medial malleolus, which is always medial. So here should be the medial condyle. Why this is the lateral condyle? Because the fibula, which articulate on its proximal fibular notch, is usually lateral, right? Because the tibia lies lateral, is the major bone of the leg. I mean, the tibia lies medial, is the major bone of the leg, right? While the fibula is an accessory bone of the leg, it should lie lateral, right? So that is how it works. Now, located between the two condyles is a profound bony projection. Called the intercondylar eminence, right? Is a profound bony projection called the intercondylar bony eminence, right? Now watch. Here is the intercondylar bony eminence, right? It is a profound bony projection. In between this intercondylar bony eminence lies the medial and lateral intercondylar tubercle. That is the intercondylar tubercles. That means this is the medial intercondylar tubercle, while this is the lateral intercondylar tubercle. This medial and lateral intercondylar tubercle provides site of attachment of the ligament and menisci of the knee joint. They provide site of attachment of the ligament and the menisci of the knee joint. However, the intercondylar tubercles usually project or fit into the intercondylar fossa that is found or located at the posterior aspect of the distal end of the femur. That is where it fits in, right? Go and watch my video on femur so that you understand what I meant by intercondylar fossa, which is found on the posterior surface of the distal end of the femur, right? So that is the feature on this articular surface of the proximal aspect of the tibia, right? Now, at the base of the lateral condyle bears a facet called the fibular notch. Here is the fibular notch. This fibular notch is called the proximal fibular notch, which provides site of attachment of the head of the fibula in order to form a profound proximal joint called the proximal tibiofibular joint, right? So that is how it works. So that is all about the features of this proximal end or the upper end of the tibia. Let's quickly look at the shaft. You can see that the shaft is the central portion of this bone. It connects the both extremities, that is the proximal end and the distal end. And it resembles prism-like shape. It is like a prism. Look at it here. It is like a prism, right? It is like a prism. You can see. So it is prism-like in shape. It has 3 borders and 3 surfaces, right? But we shall be discussing the borders and surfaces that has anatomical and clinical relevances for the purpose of brevity, right? So we shall be discussing those ones that has anatomical and clinical relevances. So let's start quickly with the anterior surface. Now you can see this is the anterior surface. Here is the anterior surface. The anterior surface is the most pronounced surface of this bone. It is palpable subcutaneously. You can see it. And extending to the distal aspect, that is downward towards its anterior border, is smooth and it begins to widen, right? Now, going proximally on its upper part is a rough, bony tubercle or tuberosity, which is called the tibia tuberosity. This is it, the tibia tuberosity, which provides site of attachment of the patellar ligament, right? It provides site of attachment of the patellar ligament, right? So that is all about this upper proximal end. Because of this important bony roughened tuberosity, which is called the tibia tuberosity, which provides site of attachment of the patellar ligament, right? Now, let's look at the posterior surface. This is the posterior surface of the tibia. It is flat, right? Why this anterior surface resembles a prism-like appearance. That is what that makes mainly the shaft of the tibia to be like a prism, right? As you can see, this posterior surface, this is what? Flat. And it has a bony ridge called the solear line. This is the solear line of the tibia. It is found on the posterior surface of the tibia, on its upper proximal end. It provides site of attachment of the soleus muscle, that is the small heart or the peripheral heart, right? The soleus muscle is the peripheral heart or the small heart. It does a whole lot of function in the venous return to the heart, right? So it provides site of attachment of the soleus muscle, and this solear line runs inferior-medially. It runs inferior-medially towards the medial border of this bone, right? That is how it works. Recall that it is found on the posterior surface, on its upper proximal end, right? Now, the next one we shall be discussing is the lateral border. The lateral border, which can be called interosseous border, provides site of attachment of the interosseous membrane, which connects or bind the tibia and the fibula together, right? So look at it here. This is the interosseous border or the lateral border, right? So that is all about the shaft of the tibia. It also have, we have discussed the anterior surface, posterior surface, and it also has the lateral surface. Now, on the border, it has lateral border, medial border, right? And also the posterior border. That is how they work. We just discussed those ones that have clinical and anatomical relevances, right? Now, let's quickly go to the distal end. The distal aspect of this bone is widened a lot in order to aid stability and weight bearing of the body, right? Now, this distal aspect, as you are seeing it on this manner, the distal aspect, the number one feature of this distal aspect is the medial malleolus. Look at the medial malleolus. You can see it is what that determines that, yes, this bone is the medial aspect or the lateral aspect. So the medial malleolus usually found on the medial aspect, while the lateral malleolus is the distal aspect of the fibula that forms it, which articulate on this distal notch here, because we have proximal notch at the upper part, we have the distal notch at this region. When it receives the distal end of the fibula, it creates a joint called the distal tibiofibular joint. While the proximal notch creates a joint which is called the proximal tibiofibular joint, right? So the medial malleolus is a profound bony projection which runs inferiorly on the medial aspect of the distal end of this bone of the tibia, right? It articulates with ankle bones to take part in formation of the ankle joint, right? Now, on the posterior aspect of this distal end, which is here, on the posterior aspect of this distal end, which is here on this region, provides a groove in which the tendon of the tibialis posterior passes here. It provides a groove in which the tendon of the tibialis posterior passes through, right? However, on the lateral aspect of this distal end, which is on this region, provides a notch which is called the distal fibular notch. It receives the distal end of the fibula to form the distal tibiofibular joint. Recall that the lateral malleolus is formed by the distal end of the fibula, while the medial malleolus is formed by the distal end of the tibia, right? These surfaces here accommodate the bones of the ankle. It accommodates bone of the ankle, right? In order to form the ankle joint, mainly by the calcaneus, because the calcaneus is the largest bone of the ankle, or the largest tarsal bone, right? Now, let's quickly look into the fracture of the tibia. Tibia has numerous fractures. It mainly fractures at the shaft, right? It mainly fractures at the shaft. Now, the fracture of the tibia is divided into two. We have the higher energy fracture, which is more prevalent or prominent in younger people, while the lower energy fracture or trauma, which can also be called the insufficiency fracture, is more prevalent or pronounced in older people, right? So we have two traumas or two fracture, the high energy trauma and the lower energy trauma. However, we have what we call the fracture at the proximal end of the tibia, which is called the tibia plateau fracture. When there's a tibia plateau fracture, automatically it means that there is a breakage of the condyles. The condyles will become broken. There will be a breakage of the condyles, thereby leading to a lesion to the ligament and menisci of the knee joint. That will lead to the compromisation of the knee joint. The knee joint will be compromised, whereby there will be a problem on its stability, right? We also have fracture at the shaft of the tibia. That is when it fractures by a heavy trauma. It might lead to a compact fracture. It might lead to a spiral fracture, right? But tibia mainly fracture at the shaft. It mainly fractures at the shaft, right? Now, let's go to the distal end. We also have fracture at the distal end of the tibia, mainly by the fracture of the medial malleolus. When the medial malleolus fractures, it occurs as a result of the ankle being twisted inward or over inversion of the ankle. When the ankle being twisted inward or the over inversion of the ankle, it means that the talus bone will be forced against the medial malleolus. Because when the ankle is twisted inward, that is over inversion, it leads to the fracture of the medial malleolus. But how does it work? It works when the talus is forced against the medial malleolus, thereby leading to the spiral fracture of the medial malleolus. Although we also have the fracture of the lateral malleolus, but these fractures are mainly rare. That is the fracture of the medial malleolus and the lateral malleolus, that is the distal end of the fibula. The fractures are mainly rare, but it occurs, right? It occurs. So it occurs as a result of the talus bone being forced against the medial malleolus, thereby leading to the spiral fracture of the medial malleolus, right? Now, you also have to understand that patients who are suffering from compartment syndrome should be monitored in pre-operative and post-operative phases, right? Because of the tibia bone. That is, if they have the compartment syndrome at the leg, right? They have to be monitored closely for the signs of the compartment syndrome in post-operative and pre-operative phases, right? So that is all about this compassionate bone. I believe you can study this bone on your closet and get it rightly by the virtue of this explanation. Thank you so much for staying to the end. I really appreciate